Hello. Thank you for joining us for this AGA webinar on effective grassroots advocacy for practice administrators. I'm Carla Ginsberg, Chair of the AGA Public Affairs and Advocacy Committee and a private practitioner in Boston. We hope this webinar will help you as you consider ways to work with your practice to become more politically active. The AGA has always been active in political advocacy. We believe that if GIs don't advocate for themselves and their practices, no one else will. Today, I will review AGA's legislative agenda and the issues that are at the forefront of GI. My colleague, Don Campbell, who is chair of the AGA PAC Board of Advisors, will discuss AGA PAC and its importance in the political process. Finally, Mike Roberts, who's the AGA Vice President of Public Policy, will highlight the importance of grassroots advocacy and the ways in which you can become involved both personally and at a practice level. Please note that all questions will be answered at the end of the webinar, and to ask a question, just type your question in the question pane. So I'm going to start with the slides, and I will be talking about the AGA's legislative agenda. So the first slide, please. One of the reasons for having this webinar really was to reach out to all the practice administrators to essentially entice you to become really the gatekeepers for your practices. And practice administrators can really help organize grassroots and political activity within your practice. And it's really important to understand the issues affecting your practice as well as your patients. Next slide, please. So I would like to tell you what the issues are, what the AGA is doing on behalf of our members, and how this can affect your practice, and basically why we're doing this. The Public Affairs and Advocacy Committee meets twice a year, and our goal is to identify key issues of concern to gastroenterologists in legislative and regulatory areas, and to develop really an advocacy strategy to guide its activities. Next slide, please. We have a very rigorous public policy agenda, and we deal with many legislative issues: reimbursement, federal funding of research, healthcare reform, patient cost sharing for colonoscopy, ambulatory surgical centers, drug shortages, medical liability reform. And I thought what I would do would go over each of these areas briefly and touch on some of the key issues. The next slide, please. In terms of reimbursement, this is important because this really improves access to high-quality care. The AGA endorses equitable Medicare physician payment formula, which is basically to fix what we call the sustainable growth rate formula, which has been flawed and we've been using for many years. Each year we have been subject to deep cuts in payments because of this flawed formula. And this year we are hoping that this formula will be repealed. The problem is that's going to cost $175 billion to repeal this, but currently it is up before the House and the Senate committees. We also are trying to promote Medicare physician payment reform, which promotes high-quality care, and we are preparing for a value-based reimbursement system. With all these deep cuts, physicians cannot keep up with their overhead, and we have to see more patients in the same time span or cut our overhead and see less patients, and all of this does become an access issue. Next slide. Another issue is federal funding of research. Each year there are 72 million visits to the doctor with the first diagnosis of being digestive diseases. And unfortunately the NIH will see cuts of 5% at least. So it is important to us to avoid loss of promising research, and we need to keep pace with inflation. The NIH budget has lagged behind inflation for many years. So we aggressively support a 4.5% NIH funding increase. We are hoping to fund NIH at $32 billion, and we reject any additional cuts which are scheduled to be implemented, especially as part of the sequestration. Next slide, please. Another big issue is healthcare reform. With the passage of the Affordable Care Act, there remain serious concerns with the provisions, many of the provisions of the legislation and their impact on GI. So it's important for us to be proactive and preserve the role of the specialist. To guide the impact on gastroenterology, we are carefully and closely monitoring implementation of the Affordable Care Act. We advocate to change many provisions regarding reimbursement, health information technology, physician quality reporting, crisis and primary care, where it's important to influence the regulatory process and to develop clinically relevant quality measures. Next slide. Patient cost sharing is important. Also, we're working on that for colonoscopies, and this is overall to encourage more screenings. The AGA has been working to correct cost sharing for Medicare patients when colonoscopy becomes therapeutic. Basically, Medicare covers the cost of screening, but if a polyp is found, the patient has to pay 20% of the cost. And this has been corrected for private patients, but not for Medicare. So we are supporting what's called the Removing Barriers to Colorectal Cancer Screening Act. Next slide. Ambulatory surgical centers is another focus of ours. Ambulatory surgery centers offer patients a convenient, cost-effective setting for procedures, and they perform more than 40% of Medicare colonoscopies. However, they've been threatened due to declining reimbursements. And again, this becomes an access issue, so we support stabilizing payment rates, basically changing the adjustment to a hospital market-based update. Basically, Medicare has been paying hospitals about 75% more than ambulatory surgical centers for outpatient surgery. And in the 2000s, this was 16%, so this really has gone up. And the ASC payment now uses the Consumer Price Index, which we are advocating to change. We also support, therefore, the ASC Quality and Access Act that establishes equity and stability in payments. And we also are supporting use of the same EMR system in both the office and the ASC. Next slide. The CRC screening for the uninsured is a big focus of ours. As you know, colorectal cancer is the second leading cause of cancer deaths, and over 50,000 people die annually. And one of our goals is to prevent colorectal cancer. And this leads to cost savings for healthcare system as well. So we are supporting the CDC's colorectal cancer control program, whose overall goal is to increase screening rates among everyone from 64% to 80%. And we request Congress continue to support this program, which should be over in a year. It was a 5-year program. And we are supporting the Colorectal Cancer Early Detection, Prevention, and Treatment Act. Next slide. In drug shortages, the AGA has helped form a coalition of specialists to take action on drug shortages, which impacts endoscopic procedures. There was an issue with fentanyl and Versed in the past. And this does address sudden discontinuation of drugs. So we address this addresses the shortage of sedative drugs, and we have supported Preserving Access to Life-Saving Medication Act, which addresses this and broader issues due to savings and manufacturers discontinuing drugs. And a lot of these provisions were included in the Prescription Drug User Fee Act reauthorization in 2012, which did pass in Congress. Another issue is medical liability reform. This we are supporting decreasing the number of unnecessary tests, which lower healthcare costs ultimately, and ultimately does increase access for patients. So we do endorse medical liability reform, which means basically a lot of different issues, compensating injuries with a cap, limit on lawyers' fees, speedy resolution, and limit frivolous cases. Next slide. So in summary then, our overall advocacy goal, it's important to advocate because by understanding the issues affecting your practice and your patients, you can advocate for quality health care and influence healthcare policy. So next I'm going to turn this over to Don Campbell, who's going to talk about the PAC. He, again, is chair of the AGA PAC Board of Advisors. So he'll discuss the PAC and its importance in the political process. Thanks.
Thank you, Carla. This is Don Campbell. I am in practice in Kansas City, and I am chair of the AGA PAC Board of Advisors. As Carla indicated, the AGA PAC is the Political Action Committee, and the comments that I make may seem as though they're directed to gastroenterologists and not the practice administrators. But I can tell you my practice administrator, I'm hesitant to use the word, controls my life, but she certainly organizes it and regularly reminds me of what I need to be doing, what I should be doing, and what I should not be doing. And that's the reason your role will be critical in getting the gastroenterologists in your practice to become more involved in advocacy and hopefully the AGA Political Action Committee. The first slide addresses why should the gastroenterologist be involved. Next slide, please. And the legislative areas of concern for gastroenterology over this past year and during the next year, a 30% reduction in reimbursement to practices under SGR has been proposed for 2014. An additional 2% reduction per year with sequester has occurred. The proposed budgets for GME, which would be GI fellows in training, has been cut. There's ongoing review of the relative value for endoscopic services ongoing. Next slide, please. So what is the role of a political action committee? Well, a political action committee is organized for the purpose of raising and spending money to elect or defeat candidates. And most political action committees represent businesses, laborers, or ideological interests. And obviously, gastroenterology is important to the AGA and its PAC. Now, political action committees can give up to $5,000 per election to a candidate, and political action committees can receive up to $5,000 from any one individual per calendar year. The next slide demonstrates how expensive winning an election is. This is a busy slide, but if you just look at the top row, it shows that in 2010, the winners in the House seats spent about $1.5 million, and the winners for the Senate seats spent almost $9 million per Senate seat. At the bottom of that page, you can see, for example, Hillary Clinton's election, she spent $30 million. There was another election in New Jersey where approximately $63 million was spent. So it's become very expensive winning these seats, and political action committees help fund these very expensive campaigns. The next slide demonstrates or talks about gastroenterology and the value of a PAC. And certainly a facilitator is needed for access to the members of Congress. And our PAC contributions allow us to get in front of the members of Congress and explain our ideas, our positions, our concerns to them. And the best way, letters are great, emails are great, but the best way to get a point across is to have a face-to-face interaction. Second, finally, since gastrointestinal disorders are so common, many members of Congress can relate to the legislative concerns of the gastroenterology community and frequently want to discuss some of their personal experiences with us when we have the opportunity to have face-to-face interactions. The next slide, AGA PAC is gastroenterology's voice on Capitol Hill. It was established in 2006 to help advance AGA's public policy priorities in Congress, and it's governed by our peers. A board of advisors oversees all the distributions from the PAC. It's an 11-member board, and is geographically diverse with each member representing a region. The next slide simply demonstrates the geographic diversity. We have representatives from Virginia, Arkansas, Missouri, Kentucky, New Jersey, Georgia, California, Washington State, New York, and Massachusetts. The next slide, the AGA PAC board follows specific contribution guidelines to ensure sound giving strategy. Our activities are reported in the AGA PAC quarterly newsletter, AGA PAC Insider, and all activity is on record with the Federal Election Commission. Next slide, the AGA PAC is what's called a connected or affiliated PAC, and that means that each contribution to the AGA PAC goes directly to candidates. Overhead expenses are absorbed by the AGA rather than the PAC, and again, all contributions are used to support candidates and political parties. Only AGA members can be solicited and can contribute to the AGA PAC since it's a connected or affiliated PAC. The next slide is probably the most important slide in the entire presentation, and that is, number one, contributions can be leveraged. If one gastroenterologist makes a $500 contribution to a campaign, that's nice, but if 10 gastroenterologists make $500 contributions to AGA PAC, and the AGA PAC goes to a candidate with a $5,000 check, that's very different than a $500 check. Secondly, by working through the AGA PAC, we essentially outsource the interactions to experts in public policy and gastroenterology. We have a staff in Washington, D.C. that's on Capitol Hill virtually every day for meetings. Realistically, I could rarely get from Kansas City to Washington, D.C., or even meet locally with my representatives. Thirdly, access is critically important. What the PAC contributions do is they allow us access to the members of Congress, and they really do pay attention to what we're talking to them about and what our concerns are. And most importantly to me personally, if somebody else is doing these interactions, it gives me time to practice medicine and doing what I do best. Now the next slide looks at medical PAC givings in 2012. And this is sort of a busy slide, but at the top of this list, we see that the orthopedic surgeons contribute about $1.7 million to their PAC annually. Then we see the American Dental Association at $1.6 million, and we can look down the entire list and see the podiatrists, the CRNAs, the American College of Cardiology, etc., are contributing significant amounts of money to their PACs. What you don't see there is any of the gastroenterology PACs listed. The next slide demonstrates the 2012 election cycle in terms of the percent of membership contributing. And if we look at orthopedic surgery, about 12% of orthopedists contribute to their PAC. In emergency medicine, it's about 6.3%. In cardiology, it's just under 4%. And in gastroenterology, it's less than 1.5% of gastroenterologists contribute to PACs. The next slide, we are pleased, though. The AGA PAC to date has raised more than $500,000, and in 2012, we contributed approximately $170,000 to 69 members of Congress, candidates, or political party committees. And in selecting who we would contribute to, 91% of those who received contributions from AGA PAC won, and less than 10% lost. The next slide, I think for your gastroenterologists in your practice, it's important that they give something to advocacy. And giving anything is valuable, and it demonstrates involvement and commitment. And time, effort, or capital are wonderful contributions, but I would encourage everyone in your practice to get involved and get involved in advocacy. The next slide, you as practice managers, practice administrators are very in touch with the numbers. We as gastroenterologists, it's always said that physicians make horrible businessmen. Here is a model that you can consider proposing to the physicians in your practice. And that is that 1% of gross income they consider giving the institutions or organizations that had a role in their success, and that you want to demonstrate a commitment to ongoing growth, innovation, and vibrancy in medicine, and especially the specialty of gastroenterology. Your physicians might consider contributing to their medical schools, training programs, hospital foundations, etc. And I think most importantly, influencing legislation that will somehow affect themselves and others in our specialty, which would be political contributions. The next slide, in terms of advocacy, if those in gastroenterology don't advocate for gastroenterology as a specialty, and gastroenterology practices and healthcare professionals and their employees. No one else will. So I would encourage your physicians to get involved in some way. And then the next slide, if individuals do want to contribute to the AGA PAC, they can contribute via mail, dues renewal, telephone solicitation, or online. And again, all contributions to AGA PAC are used exclusively to support federal candidates. No funds are used for overhead. And then finally, I would encourage you as practice managers, if you do meet with any of the members of Congress, underscore the importance that when we talk about reimbursement, we're not talking about reimbursement to physicians. We're talking about reimbursement to small businesses. And if there are significant cuts in reimbursement, there will likely be job losses in these small businesses that are supported. I'm going to stop there, and Mike Roberts, the AGA Vice President of Public Policy, will now be taking the microphone.
Thanks, Don. This is Mike Roberts. As Don mentioned, I am the AGA's VP for Public Policy. And for the next couple of minutes, I'd like to talk about kind of the nuts and bolts of grassroots advocacy and how you can be effective in grassroots advocacy. We have three key goals in terms of our advocacy efforts. And the first one is to effectively convey GI's message on key public policy priorities to Congress. The second is to establish and further develop relationships with congressional offices. And then third, it is to find grassroots advocacy a rewarding experience and have fun. This should be an enjoyable experience for you, and hopefully with the information and tools we provide to you, it will be an enjoyable experience for you. Next slide, please. This is a very telling slide in that a lot of people don't realize that there are a lot of staff people on Capitol Hill and also in local offices. As you all know, there are 100 senators in the U.S. Congress, 435 House members, but there are approximately 30,000 staff who provide support to those members of Congress and the various congressional committees that they sit on. Next slide, please. So, congressional staff, they do play a very vital role. They serve as the alter ego of the legislator and actually think very much along the same lines as that legislator does. They make recommendations to those legislators that carry a substantial amount of clout. They certainly do their homework. They tend to listen well, and they convey all of that information to the legislator when they make their recommendations. They all have widely varying degrees of experience, and as those of you know who have met with congressional staff, they're quite young. The average age is 31, but it's not uncommon to have a meeting with someone who's in their early to mid-20s. Next slide, please. The way to be effective in congressional meetings is to have a plan when you go into that meeting. And you should keep your plan to keep your meeting at about 15 minutes or less. Members of Congress are very busy, and so are staff. So they appreciate you being punctual. Also, if you do come to Washington and meet with your member of Congress, you need to build in some extra time to get into the congressional office buildings. There are metal detectors at every entrance. They will look through your bags. No sealed envelopes are allowed due to the anthrax scares that went on a few years back. Also, it's good to expect the unexpected. Often meetings are canceled. You don't see this quite as much at the local level, but certainly in Washington, votes come up and members of Congress are pulled away for other activities, and so sometimes the meetings are canceled. You may often have a meeting with a more junior staffer but you shouldn't take exception to that. Members of Congress really do want to hear what you have to say. And then oftentimes there's kind of an ad hoc approach to meeting when things are busy, and sometimes you'll meet in the hallway. And again, don't take exception to that. It's still a great opportunity to meet with your legislator. So there are a number of keys to successful meetings. One is familiarize yourself with background on your legislator. It's very helpful to know the biographical information in the committee assignments. You may very well find something in the biographical information that has a connection to you or someone in your practice, and that's very helpful. Limit the number of issues that you discuss to 1 or 2. Sometimes legislators will ask about others, but really try to keep the focus on 1 or 2 key issues. And then also use personal examples to accentuate your points. More keys to successful meetings. It's actually very helpful if you take 2 or a few more people to meetings. However, always designate a primary spokesperson to take the lead on discussions, and then you can engage in kind of a tag team approach where your colleagues can offer examples to accentuate your points. Make the requests very clear, and do have requests when you go into the office. So at the end of your meeting, summarize your key points, and then make the specific ask at the end. And most importantly, offer yourself as an ongoing resource on GI issues. This is really a key to maintaining a long-term relationship with your legislator. Another key part of meetings is in-meeting follow-up. It's important to ask the staffer for the preferred method of communication. That would usually be email. Sometimes they do prefer phone, but email is by and large the preferred method. Don't forget to send a thank you note. That's very important to let legislative offices know that you really appreciate their time. Also, we've developed an advocacy guide, which we'll share with you after the webinar, that has some key tips for effective grassroots advocacy. And there are specific email tips in that guide. Those are important because congressional offices receive over 200 million emails each year, and it's hard to sort through all of those, as you can imagine. And also in our advocacy guide, it would be important for you to complete the debriefing form on your meeting so AGA staff can follow up. There are some resources for you online, and one of the most important is our CapWiz system. And that system allows you to log onto our website, determine who your member of Congress is if you don't know, and also to be able to send a letter on a key issue to your members of Congress. We currently have 3 issues with letters on our CapWiz site right now. Then you can certainly go online and take a look at that, and feel free to send a letter even today. Also, other key resources are AGA's weekly e-digest, e-publication. We have an AGA Washington Insider policy blog that we regularly contribute to keep you up to date on key issues. On the AGA website, we also have issue briefs. Also, look to myself and the rest of my staff to help you with any issues that you would like to bring to our attention. And then, as Don mentioned, we also publish a quarterly AGA PAC insider newsletter with some key information. So I'd just like to take a few minutes to talk about building relationships in the legislative process. In terms of building long-term relationships with legislators, there are a couple things that are particularly effective. One in particular is to invite your legislator to your clinic or hospital or your practice and to conduct a tour. That's a great way to teach legislators and their staff about the real inside of what goes on in a practice. Also, offer to be an advisor on health or GI issues. Members of Congress are always looking for expertise, and you are the experts on GI issues, so that would be very well received. And then another key way to develop a relationship is to hold a fundraiser in your home or office. The AGA PAC can assist in that way by providing some seed money. We've done that in a number of occasions, and it's a terrific way to build relationships. Just a few words on the legislative process. In our advocacy guide, we have a more thorough explanation of the legislative process, but it would be important for you to familiarize yourself with the basics of the legislative process. Some of those basics include what are the key health committees, what are critical times in the legislative process, who are the champions on GI issues. It's also important to be realistic about the chances for success on legislation as well. There are about 10,000 bills introduced in any session of Congress, and only about 5% of those bills that are introduced actually become law. We've developed an effective advocacy paradigm for grassroots activity and legislative success, and that really starts with people like you who are grassroots advocates and develop relationships and educate legislators on the local level. AGA PAC activity helps facilitate those relationships, as Don mentioned, and also AGA lobbyists such as myself who can serve as resources for you and can convey your messages to members of Congress here in Washington while you work locally. I'd like to wrap up my presentation by talking about the top 10 things congressional staff hate to hear, and deliberately wanted to put this in a more humorous context, but there are some key messages in here as well. Number 10, but I thought my appointment was with the senator. It may have been with the senator, but there's a likely possibility you may end up meeting with the staff. Do not be offended, please. It's quite common, and it's no reflection on the importance of your meeting. Number 9, here's some reading material, our 300-page annual report. No one on Capitol Hill will read a 300-page annual report, so keep your messages to one page if at all possible. Number 8, how much of a campaign contribution did your boss get to vote against this bill? As you can imagine, that probably won't go over very well. Members of Congress do not like the implication that they were paid to vote a certain way. Number 7, I assume you know all about HR 1234. They may very well not know about that bill, and they may not know the bill number. So don't make any assumptions, and just stick to key talking points, and that will be very well received. Number 6, I don't have an appointment, but I promise I'll only take a half hour of your time. Please make appointments in advance. It's key to make appointments, and it's very hard to get any time with a staffer or a legislator if you just drop by. Number 5, no, I really don't have anything specific. Like I said earlier, have key talking points and have an ask for the end of your meeting. It's very important that you're efficient in your meetings, and that will make them much more effective. Number 4, we have 10 people in our group. As I mentioned earlier, it's good to have a couple colleagues go along, but don't take too many people because it's hard to accommodate in relatively small office space. Number 3, what you're telling me can't be right. I heard Oprah say otherwise. Certainly feel free to disagree with legislators and their staff, but don't insist on the correctness of your position. They certainly like to hear people with different viewpoints, but be respectful in how you differ with them. Number 2, what do you mean we have to stand in the hall? As I mentioned earlier, congressional offices are extremely busy, and the fact that you might have to stand in the hall because there's not enough room in the offices is no reflection on the importance of your meeting. And then number 1, is, how would you like to live on $300,000 a year? Most congressional staff make fairly small salaries. A health legislative assistant probably makes around $35,000 to $40,000 a year. So they're definitely not in that occupation for the money. So please be mindful that you're talking with people who probably are foregoing much more lucrative careers to be involved in the policy process. Here's my contact information. I hope you will feel free to reach out to me at any point, and we look forward to working with you, and certainly encourage you to be more active in the AGA's Congressional Advocates Program. Thank you.
Great. Well, thank you, Don, and thank you, Mike. We do have a few minutes to take some questions. And as a reminder, if you have a question, please type it in the question pane, and it will be answered in turn. And if we can't get to all the questions, we will post a Q&A online. So, are there any questions?
Okay. Hi, this is Amy Frank from AGA. I will be directing the questions. The first question we have today is, how do I actually call my legislator's office to set up a meeting?
Actually, there is a capital operator where you can access any congressional office, and that phone number is 202-224-3121. And when the operator comes on, simply say the name of the legislator you'd like to contact, and you'll be directly referred to that office.
Thank you. Another question we have today is, how do I access CapWiz to identify who my legislators are?
Actually, if you go online and go to www.capwiz.com/gastro, you will be able to access the CapWiz site. There's an opportunity in there to enter your zip code, and that will tell you who your House member is and also your 2 senators. Okay, here's another question is, what online resources are available to track bills and also find out more information about my member of Congress? There are actually a couple different websites that are great in that regard. As far as legislation goes, there is a site called Thomas, and the website address for that is Thomas, THOMAS.loc.gov, and that has biographies of your legislators. You can track legislation by the bill number or entering certain keywords, and it is a very informative and useful tool. Also, if you want to find out additional information on your members of Congress and on the issues they follow, the committees they're on, you can go to clerk, C-L-E-R-K, .house.gov, G-O-V. And that also is a very useful website in terms of finding out additional information.
Okay, we do have a question about whether slides will be available after the meeting. Yes, we are recording this session, and we will send out the link to the recording and the slides probably early next week when they're available.
Okay. So
right now, those are all the questions that we have today.
Okay. Great. Well, thank you all so very much for joining us today for the AGA webinar on effective grassroots advocacy for practice administrators. And as Amy just mentioned, the recording of the session will be available on the website, on the AGA website in a few weeks. And additionally, we will send you a copy of the AGA Grassroots Advocacy Guide. And please continue to read AGA eDigest for more information about policy issues of importance to GI and how you can get involved in advocating for the profession. And thank you all very much.